Good evening, and welcome again to Public Perspective. I'm your host, Kevin McDermott. And of course, the subject of healthcare is very much in the news now and has been for quite some time. But healthcare comes in many forms. Tonight we'll be talking about a particular aspect of healthcare, the subject of breastfeeding for infants. Our guests tonight are from the Chicago region for the Breastfeeding Task Force. We have JoAnn Posley, JoAnn Allen, and Dana Posley. Dana, JoAnn, thank you so much for being here.
Thank you.
Thank you for having us.
So, JoAnn, I'll start with you. Tell me, what is the task force? Why is it, and how did it get started?
The Chicago Region Breastfeeding Task Force is actually a part of the Illinois State Breastfeeding Task Force, and it was started many years out of a collaboration with grassroots community organizations because moms needed help breastfeeding, health professionals needed education, and we needed to learn how to network and teach each other so we could support our moms as they made decisions to breastfeed.
Well, how did it get started? Where did the idea come from to create this task force?
Nurses, healthcare providers, from people who were working in the community who saw a need because they saw that breastfeeding wasn't being supported. Mothers would go into the hospital with plans to breastfeed, and then there were obstacles that were put in their way. So they knew that someone had to help. So it came out of some of the grassroots. There were people from the Leche League. There were people from some organizations such as there was Breastfeeding Connection, nurses, dietitians. So it was something that was needed. The communities needed help with the breastfeeding.
So given that there are these other organizations, Leche and the others, what is the role that this task force serves that is not served by those other organizations? Dana?
I would say that we're really servicing the community inside of the Chicago area itself. So we are within the inner city. So we have the hospitals and we talk with the communities that are within the city itself.
Within the actual city limits, or do you go out to the suburbs at all, or is it really within the limits of the city of Chicago?
We do go out to the suburbs, but majority of what we do is in the city. Mm-hmm. Yes.
So this will seem like an obvious question, but why do we need education on breastfeeding? Isn't this something that women have done since before the dawn of recorded history?
Yeah, since the caveman days. But what we think probably happened was years ago, people figured that there was a way that money could be made on feeding infants. Because unfortunately, there are very, very, very small number of moms who have problems breastfeeding. And someone came up with an idea to create a substitute for what we know is the best. And they were making money on it. So anytime...
Do you really think it was, I mean, that sounds like a very cynical approach. Do you really think that really was the motivation, that in healthcare, it really was not about someone thinking that they had a better way or that there was something advantageous to this formula? Do you really think it was about money?
I think what happened was moms needed help because some moms had to leave the house and go to work. Moms needed help because they were having some challenges, and someone came up with an answer. For years, for centuries, people had to come up with formulas, but then when you mass produced it and tried to give it to people who didn't necessarily need it, because if they got the help they needed, then they wouldn't need the formula. So now we think that formula is what is the easiest, but it's not. Mothers make breast milk for their babies, and I say, how many cows do you see coming to ask us for their
formula?
milk? So why am I giving my baby a cow's milk?
Dana, I'm sure you probably agree with that position as well,
Yes.
but what do you think caused the healthcare industry? I mean, I think most doctors, nurses are responsible and really do care about the welfare of their patients. Of course, there's always exceptions in any situation, but how did the hospitals and the medical community get persuaded that formula was a better idea?
Well, formula is made by drug companies. So the drug companies, the pharmaceutical companies, they are known to give out, certain perks to doctors and to their staff for pushing, I would say, their products. And for the pediatricians, one of the biggest ones is to push the formula. And that's why they give, they talk about which formula is best for the infant. And then they went a step further by putting it in the hospitals and making it free for the hospitals who have formula to give to the infants. So they hooked you at the hospital.
The first dose is free. Right?
First dose is free. And they get you in the hospital, and then they've got you for the rest of your life, because you go from you go from their customer as an infant to their customer as an adult when you're now taking medication for diabetes or medication for hypertension. So you've become a lifelong customer of the pharmaceutical company.
But
JoAnn?
the breast milk is free. So what I want to talk about is the breast milk, the breastfeeding. That's what we should be talking about as the norm. When mothers want to breastfeed their babies, you need people to help support them. And that's what the task force can do. The task force can help educate healthcare providers. We network with and collaborate with WIC so that we can help educate the mothers in the community. I'm sorry, WIC is the Women and Infant and Children, and that's it's actually a state program that will help provide supplementation of infant feeding. And they needed help. So the task force is a great organization where a large group of women come together. You have peer counselors, you have lactation consultants, you have nutrition, you have mothers, you have community-based organizations. We also have the hospital-based organization, the city, the state. It's a collaboration and it's a networking. And we do all types of education, such as our networking events, where we have people come from all over the city and they come together and they learn and work with each other so that they can help moms breastfeed.
So Dana, I'm listening to this, and it sounds like there's quite a large organization, a lot of pieces to it, moving to help women do something that really should be very natural, right? Coming back to the idea that this has been going on since the cavemen were roaming the planet. Why does it take this much organization to get back to something that should be just a natural part of life?
Well, it really has to do with advertisement. Now, with all the advertising media outlets, today it is meant to be okay, and I like to say, not so much like a hands-off parent, but with the formula, you don't really have to be a hands-on parent to formula feed. It's easy for you to make formula and you can hand your baby off to someone else to feed your baby. So through different ways and different aspects, they've made it normal that formula is the best way to feed your baby and the best way to start the nutrition of your family.
Well, that's an interesting point. JoAnn, let me come back to you on that. There are a lot of working mothers, a lot of single mothers who may have to work multiple jobs. So if you're in that position and you really do need to save the time, or you do need to help, someone else has to be able to feed your baby because it's just maybe too tough for you. How do you handle that situation?
Well, what you do is you learn how to hand express or pump your milk, and you get support and learn how to store the milk. And what people don't realize is it takes a lot more work to give that other product. The milk comes from the mother, and it's perfect. You don't have to add things to it unless there's special situations. If a mother is ready to go back to work, we prepare her by encouraging her to pump her milk about a month before she goes back to work. We encourage her to not give her baby any formulas, any nipples, until her breast milk has been well established. And that way she has a large production and she has enough milk to give her baby, and then she can pump and store a little bit. And then when she goes back to work, she takes that to the daycare provider and teaches them about heating it, of course never microwaving it. But then she's also gonna miss less work because her baby's not gonna get as sick, because her baby is now taking the breast milk, which provides immunity. It helps protect her health as well as protecting her baby's health.
I would never have thought of that, but I think that that's a really interesting point, that the baby will be healthier.
Much healthier,
and
smarter.
your work life is going to be and home life is going to be easier if you do this.
Yes, and to me, breastfeeding is the first step in preventative medicine.
The first baby shot, the first immunization.
Right.
That's what we
It's
say.
your first, right, it's the first immunization that your baby gets. You're giving your breast milk because it contains those antibodies. So literally, moms are making medicine from the get-go for their baby to protect this new baby that just came out perfectly spanking brand new. You know, it hasn't had a chance to have the antibodies, you know, of their own to build up, and she's passing that on to them. So she's giving them the very best, healthiest start in their life.
So you mentioned a minute ago it makes the baby smarter. How do we know that?
Well, there's a lot of studies that have been shown to make them smarter, but think about it. What happens when a mother breastfeeds her baby, she's holding the baby at the perfect length away from her face, and then she's interacting with the baby. Child development specialists will tell you the more you talk to the baby, the more you look at the baby brain begins to grow. And also, as you're breastfeeding the baby, you're spending much more time interacting and engaging your baby. How many times have you seen a mother who puts the bottle in her baby's mouth and she's like this, or she's looking away, or the baby's got the bottle propped? Mothers, when they're interacting, the breasts actually warm up to heat the baby if the baby is on her breast. The mother who breastfeeds her baby, and actually we know it's so much better for the hospitals, that Illinois has made requirements that every baby, when they're born in Illinois hospitals, be put on their mother's chest and skin to skin as soon after birth as possible. And as we work to improve breastfeeding, we're actually going to be encouraging mothers to put their babies on their chest within 5 minutes of delivery, naked on the chest, because that will help the baby warm, it'll help the baby regulate it, and it helps bring the baby to the mother at the right time, so that when the baby's ready to eat, the baby's right where the baby needs to be to breastfeed. So if you don't learn anything else about breastfeeding, put the baby in skin to skin, and the baby's going to breastfeed much easier.
So it'll come naturally.
If you do it,
This
when
way.
the baby is first born, it's been shown that babies go through all these stages, and within 60 to 90 minutes, the baby will latch onto the mother's breast and breastfeed well. It brings the breast milk in better. And then what happens when the baby goes home? The baby's breastfeeding better because he's learned to practice. He came out practicing.
I like the idea, yeah.
Yeah.
You come out and you do it the first thing. First thing the
Yes,
baby's aware
first
of.
thing you do.
First thing you do.
So it comes back to this natural instinct. The baby knows instinctively that this is what to do, right? And I'm particularly interested in the idea of this interaction because, and this, again, it's something I would not have thought of, but you're right that if you have a bottle, you don't have to pay particularly close attention. But if you're breastfeeding, you're just naturally, even just the physical connection alone
Yes.
is going to make you interact in a way that you wouldn't with a plastic bottle.
Yes.
Is that what you end up seeing?
Yes, and because we learn from touch. The human brain develops and it gets its little wrinkles and stuff through human touch. That's why, you know, if we're sitting next to maybe like our loved one on the couch and we haven't said anything to each other, all of a sudden one of us will just hit the other. We just have to touch them for some reason. We just have to touch. And breastfeeding makes us, I guess I can just say, more interpersonal with each other, because you're learning it from an early age. You're learning that there's a bond, or you're learning what it feels like to be really like loved because you're held. And everybody wants to be held and be felt secure at some point.
Especially early on.
Especially early on. And for babies to have that, it literally teaches them throughout the rest of their life, okay, well, we are supposed to be protecting one another. We are supposed to be, you know, talking with each other and not, you know, like sometimes we do, just have our phones or earphones on and things like that, but interact with one another. And that happens from breastfeeding.
Now, have there been any studies that you know of that link breastfeeding to social phenomena, not even just physical health? I'm sure that you can probably find that, but better education, children learn better, less social disruption, maybe lower crime rates, better jobs as you get older? I mean, are there societal studies like that that show these long-term links?
We need more studies on breastfeeding, because who's gonna agree to participate
Not
in
the
the
drug
group
companies, right?
and who's gonna agree to participate when they think that they may not get the benefit? The studies come when they do IQ tests based on whether the baby was breastfed or whether the baby was formula fed. But that's not to say we know people who are formula fed have fine lives. We're not trying to put down people who formula feed. What we want to do is, if a mother chooses to provide breast milk for her baby, be there to support her and help her reach her goals. The studies that have been done have shown that there are higher IQ. However, we need more studies, but who's going to fund the studies?
Right. There's no money to be made, again, from that kind of study, because you're not going to sell more product. Now, in terms of individual mothers, what kind of resistance or what kind of obstacles do you have to overcome when you're working with the individual women about this education, teaching them to breastfeed and teaching them how? And I mean, what do you experience when you're working with the mothers themselves? Dana?
It all depends on the mother that you're working with, her cultural background, her living where she lives, literally her support system, what she's seen, because again, breastfeeding is not the norm, which it really is the norm, but it's not seen as the norm. They don't see breastfeeding.
They don't see examples.
They don't see examples.
Yes.
And that's one of the hardest things to overcome, is to let them know there are women out there that breastfeed your age, that look like you, that are in the same situation as you are, that go back to work or to school within 6 to 4 weeks, and they successfully still make it a year or 6 months, successfully, exclusively breastfeeding. So trying to really just show them themselves in breastfeeding, I think, is one of the hardest barriers that we have to overcome first off.
And JoAnn, do you find resistance from the medical establishment, from hospitals, from clinics? And if so, how do you overcome that?
Well, I'm happy to say that we now have less resistance, because we've got so many organizations that are working toward breastfeeding. There are so many things that are changing. For example, Illinois has the Infant Feeding Act that actually requires hospitals to try and have practices that promote breastfeeding. For example, putting every baby in skin to skin right after birth.
That's state law that requires them to do that, right?
Requires hospital to attempt.
Right.
They're moving toward it. Right. They're recommending it. And what we know is that the Surgeon General of the United States has a call to action to say that we need to improve hospital practices, such as keeping the babies in the room with the mother. So when the baby is hungry, the mother can feed the baby right away. Not giving the baby pacifiers. Making sure that the mother and the baby stay together when they're feeding and when they need to have tests done. One of the things that we do, and I know Dana has a group, we know that once the mother leaves the hospital, she needs support. So one of the things that we do is we have peer counselors, and we also have support groups. So there's so many things that hospitals are now doing. And there are about 19 hospitals within the city alone that are working to be what's called baby-friendly. So when you get baby-friendly designation, that means that you've gone through a special process of working to the 10 steps to improve your breastfeeding rates. And not only do we want to help initiate breastfeeding, but we want mothers, and the goal is that babies should be breastfed for at least 6 months exclusively until the doctor says they can have cereal. But actually, we're recommending a year of breastfeeding.
Now, I just want to comment on the idea of baby-friendly. I'm glad to hear that hospitals are moving in this direction, but I would like to think that every hospital was in fact baby-friendly.
It's called baby-friendly designation, and it's very important that we're not saying that hospitals that don't have this designation are mean, but we're saying that hospitals that are working toward being baby-friendly recognize that there are ways that they can improve to help mothers breastfeed. We know we're not doing a good job. Our mothers are going home less than maybe 20% exclusively breastfeeding, and we want it to be 30%. We know that by the time a baby reaches 6 months, they may have started breastfeeding in the hospital, but they're not getting breast milk past 4 to 6 weeks, and that's what the task force does. We try and educate and help so that babies can get the formula. But hospitals are really working, and also the American Academy of Pediatrics has in Illinois, a new physician statement that is supporting this. Miss Obama, Michelle, has the obesity prevention program, and here in Chicago, what we did was, with some of the obesity prevention money, we had a collaboration for hospitals throughout not only the city, but the county. And how many times do you hear of different institutions working together to have each of us, we're competing for patients, but here we are. All of us are working together to try and improve breastfeeding. So we meet once a month, and over 19 or 20 hospitals throughout Chicago are all working, we'll say, to improve breastfeeding and get this baby-friendly designation so that more babies are born at these baby-friendly hospitals, and then we'll have more breastfeeding.
Now, you've both mentioned the ideal time being 6 months to a year.
Minimal.
I'm sure you've seen the famous Newsweek Weekly cover not too long ago of the young boy, must have been 4 or 5 years old,
Yes.
breastfeeding.
Yeah.
Is that something that you guys would advocate, or what do you think about that particular issue, that cover in particular?
Well, I actually like the cover. I didn't see a problem with the cover. Sometimes mothers do decide to breastfeed longer than a year. It's only really taboo here in North America that you can't breastfeed past 1, or that you're looked down upon if you decide to go past the age of 1 year old. Other countries breastfeed their children past the age of 1 to sometimes 3, 4, or 5 years old. So I didn't see a problem with that picture. And because if you are breastfeeding a 3-year-old, sometimes that's what they do. They're playing, and then they're like, oh, let me see, I just maybe want to drink from mom real fast. So they'll go, you know, at that moment, they just need to have attention from mom. They just need to touch mom. And so that's what they'll do. It's not like they would be drinking their entire meal from mom. It's just, at this moment, I need to be close to my mom, and then guess what I'm gonna do? Okay, I'm gonna run back and finish playing.
But as you just mentioned, it's likely that the children of that age are getting a lot of nutrition elsewhere. Right?
Yes.
They're eating regular meals. Right?
Yes, they are eating regular meals. One of the things in reference to why people are a little afraid of going past a year is they're like, oh, so we have to feed the baby the same way we did when they were 6 months, like every few hours when they're hungry. I'm like, no. When they reach the age of 1, now they're drinking whole milk. Now they're eating better baby foods, or some of them are even starting on table foods. So the time that you breastfeed a toddler is very minimal, maybe 3 times a day. They typically want it in the morning when they wake up, just like a lot of us have to have our morning coffee. They have to have their morning milk. If you're with them in the afternoon, then they might want it to take their nap, and then at night to go to sleep. That's, those would majority be their 3 times of having breast milk when they're toddlers.
And toddlers would be, what, up to about the age of 2?
Yeah, I'm gonna say, 2 to maybe about 4?
3, yeah.
2 to 3, or maybe 4.
Okay.
Yeah.
So let me switch gears a little bit, and I want to ask you about.
Before you ask, Mike, couldn't I tell you, those countries that are breastfeeding those babies to 3 or 4 years, take a look at their health care costs, and I bet they're a lot less than the United States health care costs. The United States could save billions of dollars if more babies were breastfed.
I wonder if that study's
Health
been done.
care. Many of those studies have been done. We know that the United States spends much more money for health care than some of those other countries.
Sure, we have one of the highest per capita costs of health care in the world.
Okay.
Yes, we do.
And we have one of the lowest breastfeeding rates.
There's certainly a correlation there, isn't there?
Yes.
there is.
What do you get from the fathers? Is there resistance? Is there cooperation? How do the fathers handle the issue of breastfeeding?
Well, of course, it depends on the father. You ask my son, when he was 5 years old, I had a breast pump rental station in my home where moms who needed to go back to work would come to my home to rent a breast pump. And he thought that he would tell people that I was putting the milk in the mother's breast. So he's already told me his children are going to be breastfed. So our fathers want their babies to get the best. And we at the Chicago Breastfeeding Task Force actually have special programs to educate the fathers, specifically during Father's Week. And actually, Dana's husband came to the Chicago Breastfeeding Task Force Week during our program for Father's Day and spoke to us about how important breastfeeding is. So we know that they need to be educated about it. Sometimes there's some animosity like, well, if you're breastfeeding the baby, what about me? And that's because the United States has made women's breasts such a sexual object. But we know that breasts are made to breastfeed babies. So the fathers are important. And I've even had fathers that actually have supported the mother. We had a father a couple weeks ago in one of our peer groups who actually brought the mother in because he wanted her to breastfeed and she was having some challenges. So he brought her in to help. And I think at that point the baby was almost 2 weeks old. But he knew that she needed help. And he said, and she'll be here. And she said, you know, I'm only doing this because he really wants me to. You know, she said she had had problems before. So the fathers are very important. All the support groups, the grandmothers are important. The mothers are important. The other siblings are important because what happens is if you breastfeed an older child, then the younger children see that. So that's important that they see breastfeeding.
Mm-hmm.
And you've had the same experience? Do you find that the fathers are not difficult to get them convinced that this is a good idea?
And actually, the fathers are more on board faster than the mothers. They're like,
well,
so it's...
They don't have to do it, right?
Well, yes, for one, they're not doing it. But a lot of times, because they have heard, men are competitive.
Shocking.
Nature.
Shocking.
Right.
I'll accept that. Right.
And because some of the things that they've heard is, oh, your child is going to be smarter. Oh, really? So you're saying my child is going to be smarter than your child if I get her to breastfeed? Okay, yes, I need you to breastfeed. It's just that competitive. And if that's what it takes to get the dads to be on board, I'm going to tell them, yes, your child will be the smartest, the genius of everyone.
The best looking, the best athlete.
Yes,
right.
Everything like that. So, yeah, it's the dads are definitely, they play a huge role in it. And, yeah, they're much easier. Like,
well, believe it or not, we're already out of time. So on that note,
wow.
We'll have to wrap up.
We can't talk about telling the fathers it saves them money. Fathers like to save their money, too.
yes,
well,
they do.
That's just more reason why we have to get you guys back.
We got to come back.
Right?
I'd
We gotta
love
talk
to.
further. All right. JoAnn, Dana, thank you so much for taking the time to be here. I certainly have learned a whole lot.
Thank
and I think
you
people
for
watching the
having
show will
us.
feel the same. So
Thank you.
Thank you.
And thank you for joining us once again on Public Perspective. I'm your host, Kevin McDermott. You can find us every Saturday night at 8 on Comcast Channel 19, and you can see us on the web at publicperspective.tv. Till next time, thank you and good night.